Good day, everyone. We're the Group 5 of BSN 2A from the College of Nursing of Colegio San Agustin, Bacolod, and we're here to report about acute lymphoblastic leukemia, its definitions, its causes, symptoms, exams, and tests to verify disease and treatments.
Acute lymphoblastic leukemia is a fast-growing cancer of a type of white blood cells called lymphocytes. These cells are found in the bone marrow and other parts of the body. Occurs when the body produces a large number of immature lymphocytes. The cancer cells grow quickly and replace normal cells in the bone marrow. Bone marrow is a soft tissue in the center of bones that helps form all blood cells. All prevents healthy blood cells from being made. Life-threatening symptoms can occur.
Most of the time, no clear cause can be found for ALL or acute lymphoblastic leukemia, but the following may play a role in the development of leukemia in general. Certain chromosome problems, exposure to radiation, including X-rays before birth, past treatment with chemotherapy drugs, receiving a bone marrow transplant, and toxins such as benzene. And the following increase the risk of ALL or acute lymphoblastic leukemia are Down syndrome or other genetic disorders, a brother or a sister with leukemia. This type of leukemia usually affects children ages 3 to 7. ALL is the most common childhood cancer, but it can also occur in adults.
Acute lymphoblastic leukemia make the person more likely to bleed and develop infections. Symptoms include bone and joint pain, easy bruising and bleeding such as bleeding gums, skin bleeding, nosebleeds, abnormal periods, feeling weak or tired, fever, loss of appetite and weight loss, paleness, pain or feeling fullness below the ribs, pinpoint red spot on the skin like petechiae, swollen glands, lymphadenopathy in the neck, underarm, and groin, night sweats. Take note, these symptoms can occur with the other condition. Talk to the doctors about the meaning of specific symptoms.
Exams and tests. A physical exam may reveal the following: bruising, swollen liver, lymph nodes, and spleen. Signs of bleeding, petechiae, purpura. Blood tests may include complete blood count, including white blood cell count, platelet count, bone marrow aspiration, and biopsy. Lumbar puncture or spinal tap to check for leukemia in cells in the spinal fluid. Tests are also done to look for changes in the DNA inside the abnormal white cells. Certain DNA changes may determine what kind of treatment the person receives and the outlook.
Treatment. The first goal of treatment is to get blood counts back to normal. If this occurs and the bone marrow looks healthy under the microscope, the cancer is said to be in remission. Chemotherapy is the first treatment tried with the goal of achieving complete remission. The person may need to stay in the hospital for chemotherapy, or it can be given at a clinic and the patient goes home afterward. Chemotherapy is given into the vein by IV and sometimes next to the spine and brain. After remission, more treatment is needed to be cured. This treatment can include more chemotherapy or radiation to the brain. Stem cell transplant from another person may also be done. Further treatment depends on age and health of the person, type of leukemia cells, including the DNA changes found, how many courses of chemotherapy it took to achieve remission, and the availability of donors for stem cell transplant.
Pathophysiology. In general, cancer is caused by damage to DNA that leads to uncontrolled cellular growth and spread throughout the body, either by increasing chemical signals that cause growth or by interrupting chemical signals that control growth. Damage can be caused through the formation of fusion genes, as well as the dysregulation of a proto-oncogene via juxtaposition of it to a promoter of another gene. Example, the T cell receptor gene. This damage may be caused by environmental factors such as chemicals, drugs, or radiation. Acute lymphoblastic leukemia is associated with exposure to radiation and chemicals in animals and humans. High-level radiation exposure is a known risk factor for developing leukemia, as found by studies of survivors of atom bomb exposure in Hiroshima and Nagasaki. In animals, exposure to benzene and other chemicals can cause leukemia. Epidemiological studies have associated leukemia with workplace exposure to chemicals, but these studies are not as conclusive. Some evidence suggests that secondary leukemia can develop in individuals treated for other cancers with radiation and chemotherapy as a result of that treatment. So, the development of acute lymphoblastic leukemia, like other malignancies of hematologic origin, is believed to involve a transformation event that occurs in a single progenitor cell that has the capability for indefinite clonal expansion. The leukemogenic event may occur in committed lymphoid cells of B or T cells lineages or in early precursors, which gives rise to different subtypes of ALL based on the stage of lymphoid differentiation of the cell in which the event occurred. So about 80% of all cases of acute lymphoblastic leukemia express cell surface markers indicative of a precursor B cell lineage. Only 1% to 2% of cases express a phenotype typical of a mature B cell. So T cell acute lymphoblastic leukemia accounts for about 50% to 20% of cases and is commonly associated with features at diagnosis such as older age, male predominance, high white blood cell count, and extramedullary disease, all of which indicate the need for increased intensity of chemotherapy. The identification of specific chromosomal abnormalities plays an important role in determining therapy and prognosis in certain subtypes of acute lymphoblastic leukemia. Some of the more common chromosomal abnormalities in all cases in acute lymphoblastic leukemia include the TEL-AML1 fusion gene, which by molecular techniques can be found in 25% of cases of B acute lympholytic leukemia. The presence of this translocation carries a more favorable prognosis. Unfortunately, young children with this genetic abnormality have a very poor prognosis and survival of less than 20% despite intensive therapy. MLL gene rearrangements of age greater than 1 year old, a diagnosis were found to have better prognosis than those of infants with the same translocation, but far worse than age-matched patients without rearrangements of the MLL gene.
As you can see, the left side contains the normal blood and the right side, the blood of the leukemia patient. The blood of the leukemia patient has an abnormal amount of lymphocytes, neutrophil, and monocytes. They are more dominant than the erythrocytes. These are pictures of some children who unfortunately have this disease. This is how acute lymphoblastic cells develops. From this stem cell, transform into lymphoid stem cells and turns into a lymphoid blast
where the acute lymphoblastic leukemia usually develops, and then it splits into B lymphocytes and T lymphocytes, which then multiplies.